yen we chaka modho ko winto we dai ne Ajak media production na Ajak Deng Chiengkou ku na kam tin ko ko be jam wona Dr William Deng Mach ku ko ben wa jam tin pir pan Junuba Sudan biya ko wal ku jola biya ka winto ke ye ka lubi nan ko lu ko ka ba bena ma ku kor ku bu tem a topic anan go ko nyin de medical doctor ku ka jam rata la ku ka ju jaben wo ka jam na Iran to pan Junuba Sudan eta college man tangina na nong de tinu nong in bundles ke yin de nang time we na de bin ping ne ka to ke bi wo ka jam ne ko ku the purpose is very simple and clear ka wina de ka bene ka yipio ku bara gelude ku bara ande to rwai ka yin ba gelude awe chu ka lech we ko ci ben men we tero ku tok na nong to bi we ken ben we ka chier e ka pedaret ku wo be jal du chien wo be gol ne chen ku wo te ki chier ko ke bot nyale ko we yen apet we cha ke mot we cha ke le we ko to we be ping ne man ne we ko ke te dia ku dro ana Ajak Deng Chiengkou anto na Melbourne kuran to kana ne studio ja to ne Juba water live ne man pan Junuba Sudan kun pan Melbourne ne man ta ber ku de gi ke ro ku en ke tande ya pan Junuba Sudan adila ta tier ku ro ka ta ti ku tok ene ke to ke lo e kan ruti ni yemen kun ke to ko ben wo jam tin ye ko war wo ke jam e ka wonan ke kun gran ne biya ka tajer ku jala biya ka wona de ke lo biran la twen ne ye ke yen wo be to ko wo be jam medical situations when talk to pa ni Junuba Sudan tonga ke ka daga ben wa jamatene ku yene ke ba to ka ba chote ben wa jamon Dr William e biya ke chen we ga pin ko are chan kan jam pani Junuba Sudan ka wal ke chol akim atoke che ga kwa kim abona an wa chi ke dia ana makke muna daga bo pin China ku kana ke mun bo ne pin ko gwen to ke pin ge jur ko pe ke ga kin medical practices ku jala ethical practices a to ke ka wa ne kam ko ten go ya ko to ti ku ko to ten a yine yo ki mana da gu ti tok anan pana kim chan kala tinwar a yiran yo ko gwele to China ku be ben bu wari te nan ko won to ke nan ke ti kana medical background ke chan baran bi yo ko ku le ran kana ne ke abdominal cramping ku jola ko gwena ya chi ben ki ye ko chol ya che ke ya che ben ko won ke lo skule ba war yude ne to nge. These are the challenges. So Niemen and the can Dr. Deng Chol be Brolwell Kubujalo into this conversation. Dr. Deng, welcome to Ajak Media Production. In late, thank you for your time. Good one. Yeah.
Thank you, Ajak Deng Chiengkou. Thank you for having me in your studio today. We're coping and Kicha Ben Yalla Kipedred. Kitwing, Eberin Chile work, Kuma State Russia. And I shall William Deng Mach, and it's South Sudanese by birth. Kicha Queen, and I medicines, Bachelor of Medicine, obstetric and general surgery. Something unique created in Africa. Train clinical officers to be surgeon in district hospitals because to avoid the brain drainage. Chiragol in China in 1930, and in America it's the same. But it has came to Africa. It came to Africa in 2000. In my status, and I went at the University of Zambia, China College of Health Science. And I specialize in HIV. HIV is counted under internal medicine. Kichobo today in Ajak, as we discussed earlier, 2 months. Koi kwa apoj kang yok kai pir, especially drugs. Chimana lar hila dej by Ranaban, a bokil wilan and bagar korar walka kai bindi nyai. So la e walngo balalum can I chai and conflict on a coach because I will know and che wala chaka gam charge. Nana wal ku yene yin non kala le yin ke be kwen nga gutu wer nga agor ayan ku bi panakim kagal time bien ku det kurin ke kurun ke agutu weight non kilo kede ku jala tinal ba jal teach e loid e inode e ten we no kunong nin kede abuka ka jal kwen na che ka kwen ka gar ka pin na che ka gar pin kan bi jala tin ye kno ke ka che ka lwel ki ye kno in kri ya ret in jala che bo panakem today na che signs or symptom ke di che ka lwel kan be a focus kan kero tung to ka ret che lwel che en chanin una ko ban ka focus in buka ga jala ben because non ki kene gol ke ko na major issue ko ne kene gol be na concentrating ku buka ga jala ben because that main pain in luya cause be jal ban panakim today a little gol 3 days ago a little gol 5 days ago some month or a year a little be off and on kene a little ya dig out a chan be ran ba dil yo yunguna ken kene ka an jai chani ba ban kul kul an nang nom hedek an nong hedek at han men ku bai jal gar wal kan to kurti ki bai tim chok kwane lo koy nem e chba te kwen an tin a chi alaw kana a chi alaw chan ba war gol tim tar bi ran lo cause kene lo ya scientifically kene lo ya ena gam wal chan wal ta da ba mis ken da ki cha loy in kin ngade kan prof akko le ran beide log jawal gam wal kene cha gam to the wrong diagnose a che gam wrong diagnose ku wal kene non kle create ran because wal drugs itself is like a bullets so na che tawran gop kanon kle create other condition example human paracetamol or action these drugs essential drugs a chiran go nang headache remember in 206 a chi ko ju de red wal when kan a lot of issues now iran ya jam nang ulcer so ke wal ka biran jago yo chana chi ni yin ke no me headache ye nyaai kalo ko lo mu wale alo men alo ku de abi jal go ni wal kala no small headache to ka ko le chen chat ku le nang kana kana ka go go la o chana yin ke wal war ene nom nyaai kan be ar no mi jal wala nong effect nong ini rani de yana che de for long ka yini analysis ke do ne chol gura so ka de misuse of drugs in ke ka bay because well ke ay ngade bay ay analysis bay ko ngo che bay en nam si ke chir ke yaga bele kan wo koy kwa binga wala gor le gude kana chi lo koy nim en ke status to within was Sudanese da ro rana lu ban lu an nong gal po wala nong ke rempio so amoxicillin akar kalo ko cake maybe nyin ke diang nyin ke ngwan le ku de ke so bich ta de en bin ci ngay ting num ke bin ke ne alu bu wala lu ga ñi wal ke na ci la ñi na le ñi ku le no real doctor baden the person who is experienced kalo ko jolo wala gor ko wala la ga ke ne resistant e de show resistant wala e be ci ñi kalas example man je anong man tiga cha tweet ti chi wek tong thor man tiga cha tweet dum ke koy to man tiga iwa cha ke attack I more ala ya more guide anong more guide because they are aware of water so bacteria in that person they are more guide that any drugs when like a similar side a little bit resist na chi resist ke patient ke ben no work ra no bunch of papers ra no books little bit goal 5-10 years ago beja ci gel a simple bej just infection ka ga ina jak kalorot ku ka piat ke ka cho gamben ban ba ga be cher ko nim etok ke misdiagnosed ini akim a chan lon chiro dedicate chan ba loy coach so chili ba law ke chirkana because that in the medical ethics unnecessary drugs used chili ba law that the one name is not only South Sudanese. Even when I was in Central Africa, which is Zambia, African people they prepare injection than oral drugs, which is not the case because no work ayukunyi oral drugs are more powerful than injection because injection are under so many processes. Benike jala form to injection. Abiba dilute in drugs, abiba dilute in water. So a fifth. Okay, the strength is the same, but KNHI injection able to direct into the bloodstream. A yen coach koi when nong serious illness achiran achilibu wala achilibu because of nong vomiting. Rana ngo rana maybe is unconscious. So in other way libinu wala libinu ye ran. So the only way libertao intravenous, batao riami direct, or a libertao yum, or a libertao ye a chanbu wala daja act. Kuna ada walin chungu kuin jam chiman yema one yin achin reason libani yin completely scientifically achin reason libani yin but
Yeah,
the law koi
Dr.
kwa nim
Dr. William,
you remember
Dr. William, in Jaleke, in Wabula Twinku. I like one thing, kachaka baby, and this is where we come into negotiate kubu jam kubu koi. One best example to kacha mention in yake the nature the concept manini the resistance of the antibiotics. Yeah, antibiotic yung yigla loy. When we were in Kakuma or when I was in New Kujalayan ko when chan Lutin, it was a major issue whereby na lweran ko lwele ke bay yach ka lwe la tok juk man yene tere cycline anan ko konyen na bere rande la yale ke yena there is a confusion chirogol e kam wal chi chen benazine penicillin ku benzyl penicillin ku procaine penicillin the three penicillin alo ku lui ko confusion e koinim and how they are administered arana lubu bena lo ku le yene to indi ne ke banador na jale le banador ye chol rin ko ngo because all these three penicillin groups have different usage and they must only be given to you by the doctor Dr William to kachi are qualified ku yena nang anyi the condition do ku kanyi chimana de yena be administered each of these medicine nang different reaction na ye go wo ya lekin benza la bala ting la nyin chiel benzain abalating or they call it benjatin abalating ke gernyen ku proken abalating ke gernyen they are totally different chaka mi da ka bi yende ka totally different achi dating ke ko jo ne tena ke le ben ran men ke chang do bor ke kule ya zol aganuna min zaman be dawa itama da ga tesma ana da dawa de lo tugu na le yen kule oi ya banyan che ana ma diktor I will only dispense the medicine that is prescribed to you. Kuyen kaba jalbe yenin. First of all, na nang manya dangi, kadan nang na manya dangin, there may be an infection going on. Tiyen manya dang kena red bay. Kama na to for that manya dang be, you don't need to suggest the medicine. Lord nang akim will go and give you this. Na wala we kaka chirka kaban no make law. Akacha ke one my mother on a really ye window winded within a kai gwajala mama incha umbai. Lola it will not happen. Lola yen in by I yen dictor to chin by guloko you because it cannot be coin. Because one of the people that I know a man that in the bin tom penicillin go no. So this is very dangerous. So yin pahalipio penny that anche I'm not, even though I know how to administer it, intervenous intermuscular, one thing doctor has to take that. Kidiale na ye you think ebe duong yuko. Kayen my responsibility. But how the medicine was prescribed has nothing to do with me. A culture war chala junupa de de ajindeng. Akaye yuranaban alokene la diarabul ke kenankien kanola. Kukabudu pa na kema lete bila be wala woma kanola. Buko konya de.
Thank you. Yen ke chagole de jan kunyi bene ka kony e jam. Krij bene lebe ya lwelo la ya kuma kwa hiyo ngo achi ka kora kuma kana. If for instance benga bekede ni yoge be kony beloy ku ye kene che lum ka lui fix even na cho nang long wala chin long ke kene ka ye kwancho. Ke chagole ke pet anu akor bu ko jam. Chan and she have practiced in Zambia 1 year and 6 months. Responsible. I was also teaching Chinese trained Zambian students and Mozambique and Zimbabwe. Because China and well like China, and it is because everything is cheaper. In my practice, I one time a doctor on duty at one of the hospital called Livingston Central Hospital. Example, one of my clients, 60 years old lady, anong heart problems, and then she usually come for a visit to visit medical doctor every week for examination. Panong well ke yenen. Yeni tinkene edek wine edek meow because ekwen again 1 glass of wine a non improvement in the heart. Whether like in the internet, so I check American Heart Association, like the a teacher on campus is lecturing Cambridge University. So I chabagar wal kulel no we wale abade we en wal kene today inen I chekuru either badag bango tab ache yengo tab. I'm trying to cancel ache yengo tab ache deg meow chukur meow good bit tok be react badly. The tong diet watch beduru or kram. It was terrible. so wel yin le ba le kan adagen ba mi haw ba pol akan le ken ba mi haw pol ba da jalo no kon wiping kon ka walo kon de abi kon because your heart is actually pumping a lot so na cham ya atam ya tin kana kin e ibri la man ba wala ba ngi ku yen ke den kor ku ka kor chin kon based on the advice on medical superintendents kana tin kana 1 week ke bana ko yen bijal. So in the concept of can including South Sudanese Africans among their own perception about their own health to make it even more difficult in our southern parts. Ilbaran you example wutas or anong kiti in background akon twine the queen bathul achi queen bathul ijel ben ajel ben ku jel kor bathi ke bien ko yuna ken ko node anyi yor anyi diagnose ko walde ci google ganyi na bar ku jal wo ken yen a lot of kadanga ci lu mi cin ganyi ku ka bnoy sab loy e kana liu South Sudan so in South Sudan now liu because ko ja very much aware so in that part of southern part including South Africa I think ga da gator kin well informed nga ga ci ajal kan smartphone de ku le bakana ku le ran la la ci kin nyi ne uta kana aguti kine ti tini korba yani you want sign and symptom kenji kala kine baka date ya pet baka prop up kule ko ke ko in lo ku lo like lo ka ku google ya kene be notice that was in 2021 that can actually fair a lot of clients have non complaints
There was misdiagnosis.
so kene difficult non Africans yenga kede yo kene kede be kwanchuk so kubu ko ebe ko jam because kilo rodman as we are speaking now kilo rodman panden wala ka yo ke kai nang pir ku kwen chatting to start the medicine a life kadang a time consuming uh, in le balo kwen 6 years 7 years 8 years kuna bela ban kita data ni diop so for you bana koy ku ku non kiti ngade kin lo pharmacy du pia de dingu na cha dingu du piat kin ai wal cha ta whatever le bay ran on low qualification tautin ai ran chi be ni wal luide mana te sometime I make joke with them paracetamol luide how does it act in the body achi luel like may his soul rest in peace and one of the young guy
Yeah,
in Mading if not 2021
even
2020
ending
achi wal che rari ke betaw rari rana bu to kadang bu to tin moral ten so ina jak ke bu koy koñ e yen ko loy ku bi che kaj ku bu koy bu ke ay ran pinga be pinga net nyen ay ran che pinga bi ran da misi che bi jala inform tin ngade ne loyten so ran pinga le bro koñ
yen we ko dai we te di ku bet na piange an ke tam ga ba chiere kana because a guti we ke na nan ke other medical experts in any field public health and other sectors ku korba contributing days to come then we welcome you again. I will be available to bring this a check ka chi deng luel. We want this to go on, and the reason why kalwel ku ke are very dangerous. You know, in a medical field, ku to at a stage where you don't even have a third opinion. You are only sticking to one medical decision. Ke ka kwa lebi raj, pidu lebi rot war. Yen Dr. William anang ke chalwele ten anang tungchi wa iyo ke yeto kwane denga kwe ku jalku tegi yiko chien wala wa welwa nim la chien ka loku yo pharmacy ten pharmacy eto dingi ku pharmacy eto dingi achine a cooling system in a pharmacy ku wala to anang e shirop anang e welcome win to ke shirop ku ka cha tingi anang e other medicine that could be sensitive to the level of temperature that was happening there. I think I don't know whether they will recall this Guajalu Deng. This is very dangerous for the well-being of the people. na non ki bala kuma cheman ko Ministry of Health ku ja ko how is it easy a good chakather on kichan by a pharmacist assistant on which in a bit of knowledge in pharmacology a bit of knowledge you are given an highlight of the contrary indication medicine, the grouping, the side effects. In knowledge of that, you are not considered a pharmacist. You can dispense the medicine, but you are not considered a pharmacist because in qualification, you can be a nurse, but you are not a pharmacist. You can a license to sell a medicine, and then another thing, the differences of generic medicine when is applied in other third world countries are verified through the vigorous testing in a medical field, and what are the dangers?
That is very excellent questions, John Dechen. You know, naira nake page panda gao, pandu bagao, baundu loy, bakwari. It will take some months. Kemi de jiga ter kuas ke compound. In status to within mana. Acha kuma banale balaken. Akoi lads and gam in the central Equatorial states. Okay, doing a control to cheating in Ministry of Health because maybe the biggest hospitals, but most of the clinics around central Equatoria NK license. Maybe regulation be strengthened because regulation the drugs, especially in our city here, actually good. Kichirikilo road, like example, I got it in one of the district in Uganda. Almost 80% in one of the town, ran pharmacy. Within the cycle in the Ministry of Health in Uganda, I don't coach, I don't know, they came through the window. And alula ya clinics are like assess. Ke kono clinic akon ka lu ke ko inform. That day ka you ke shut down. Leba you ke one clinic lu. Ajel team ban ka chiran yo. You ke normal shop. Okay thiek. I think maybe that's what is happening in Central Equatorial State. Maybe the kokok can license. Ko ye tinga to zingi yije. Kana le biya kuma le bloy. Ku katawo tin na again kana le be alle ke ko license gam, especially ko empowered by law.
Yeah, vulnerability there another vulnerability is that there is a human aspect in terms of education because pana ka waja tene man mera ne rajor ku ka pioche akanyi ke cholwal anyi all the human system to go ana lo indola lo kule ku ye yok yene something affecting the blood e kanang targeting when bedilo ye yok ke manade ye respiratory system de anang challenges ika now when it comes to koikwo that level of education live. People are coming with the notion that dictator situation there. And achala luela like a gurko obako a chiko teno kujo cherke chibita che achi luora yet kujo lo indol. There is also that concept that I have to exaggerate my situation tenang dictator. That the yen dictator cha yinan wal dit. Yena like a general testing a chirabloy. General testing a chirabloy. And I hear human chairman war in Sudan because we don't have other things. Here are vitamin D problem. Tangwagatani is no ranang vitamin D problem. A yen kurde nyenetene edu rakadong. A ye all the joints anang issues. Ranang arthritis. can be vitamin D bila determine it, and kukachin the testing equipment and the ability to determine that. Manatur ananang chances beneke yen misdiagnose. Kule yen wrong medicine. Na ber lo we ya chimana de yen chimane kulon kulo wal yu chiman wal ya yen dia. Come previously based on what I witnessed kukicha ting. Ka ko ye ka da yu ke yen ayon gatok by then because yen folic acid and other medicines. IDR. Ku yi chimana de yen broria can be ale bi nang iron problem. Yeah. Ku ka ale bi nang vitamin problems. Ku ka ke ben be ka chere ne man pan jinu Sudan be nang rin egura hepatitis B, hepatitis C, HIV AIDS ku jala kok. Ka ku jalo ku jali tingala ke then within the medical area and within the Ministry of Health and all over in a need for a very critical education to be presented, especially the outreach. We used to have this curative and the outreach program, and the outreach is always the active than the curative in terms of informational session. Go ahead.
Shukran, Jack. Kitwing bakan bar no question just even about the drug storage. Ayi chalwe won again peer kanya kuna ji peer kanya kinga lo no mkben leben no chaw ke ben peer. But it wala wajaret because it's a leran to work na de kichana kitije yung chini lip go le kichana lip. Until enough capacity in terms of finance. Because the war log appear the dingy, we need maybe healing board, thousand. Most of drugs are delicate. Actually rare to touch. Remember our temperature here, especially in South Sudan, are too red. So why you know drug could be in a dry, open space. I know some drugs should be in a wet area. So especially syrup actually bit of dingy. Actually, we understand because now ta well in such a place, which of Ben by Chirka today, Bala from German, Bala from USA or even China. Kuta housing today, Kikichaloi, an potency of drugs, power de, Achan Benang value, a little bit power, I call a little bit now. So a date a little bit today, Eloi today, could be expire maybe 2028. Lakin achin power better thing because storage achi quest achi wala cha now. So live up to 2028. Wala ba ya na yandu na ba ya nen ni adurkute ni after 1 week the same patient blood do. You will not be surprised when a patient can improving. Because the storage capacity of your drugs actually good. Ikena kui koi ai wal. So koi buka jam actually koi bu wala wa anam se koi bu wala so that for them even you na cha business cha loy we are yandu ye pial. Randu nu ye pial. Kabu koko la bay ke diak. That is the secret of pharmacy, and that is the secret of medical business. Ran ko piala ko la bay ke diak because alio kalori yitir war ka chan ke die chalo ile ku bay ile. The secret again can be ko ke. So without even a law, Iran chingari do avoid bawal bagata jingi. Them but them but to nong AC but bin well ku bin ka 1000. Achana lego ben ke judet ke potency achi briak. Power strength there achi briak. Kene ke le ke ko ay wal ka ku jala ke ko wal oj ka ke won chalwel regulations e akuma en kala belu regulation beloy ku ko be sensitize can be aware to be their lives be ke control thing chan anan ko loy chi akuma chi le be ke der panan ko le bi loy le bi akuma ke der immediate ku lu act because Human ranch, maybe Pamasa de Leo village or Chileo in the village. Achiakuma Chilibader. Till Benajal dear, and on Kuchera Jaloi, like example, one of the guy in Rumbek, I think 4 5 years ago, kede liu hile je cheki ni akuma. And then he was using a license of ranchu wal queen that he use. We na chin skill. So he me the bay malaria. Na bay malaria kaka ban ko yo me den Na met ke wala chi overdose because of dosages. Na de gran ya kan them. Ku jel calculation loy. A chan wal bran biche nak. So it meet bet ku lego ting syringe. Ting ku ting bet the bedir ka ber syringe thiong. Ber meje da bet syringe betiang. Na ai jol wom ke po ka ni bit ala met po ka ni le so ga ya ku jol ting ku jol ko won so innocent parents jaga ting kana che rana che ber pi ri ya che no yung bloy e bu kar kan yu da chin kar tawal wan clinic jol dein kana china kuma bidi ku dam e biyu e che ran che wal kwen ka ka de loy at the corridors chia kuma kader. So can accord because big caution can be very much aware about their life. General walai nak wal tijen ke misuse kana coach kana kor be jamit
Yen
non kok ke dun pal this program ko jam.
Indeng, thank you so much, and we will go into the what the I think wal ko na no ngane promises went up in ya then cold ya in the agenda will join. Yen one of the major things you know there on to work you know one of my doctors that trained me called Dr. Martin Longoya. Now on Goloben could be Kulwelien Kichiroloy. There is an overuse of diazepam manina toke volume ku jol dangers ke diazepam jol kalwel now ala la junuba che yo kimana de yen mi are actually using diazepam as a drug and ku jola majority of the antihistaminic medicines alo ku jali yetingeten then you can see that that is a danger to the country because they are not informed. Chairman Luberan chlorpromazine, every dangerous drug. You cannot just use it anyhow. Like a very good psychiatric doctor to administer that. Kukai most of the medicine that are actually outdated now. Now, better lo indulge man ye walwen chirman peloton kuwalkok. They can cause very serious you can be drowsy. Kujal wel kok jal kloben. Ke mane ni a group of antibiotic ne chi woke jam tablet kujala capsule. It become a choice. A good call to urwar. I went and observed something very funny, whether you are aware of this. Even while yene while ya capsula ye doto kutewe chai. Have you seen that? Ajali yelwelo, what is the dose? A dose ngokene. What is the dose? What is the dose? And how is that okay with you? Kay never risky. One of the most risky thing when it comes to life. Ayenira and ping. These are not joking things. Aka koin koi kwa gutien takpa na kawaja ka yelola ka chirika ka national security concerns. Because you because when national security ko dede jitong nangalit acheran muktuor eran gilbai ke cham ko ke cham eran gilbai ke bo bai ana yen ku gran ko jwal ke ran yen ka raja ka weran muk tuor because ran muk tuor ne ke na moy ran tuen ke tor de aping tuore dang tinang ran moy ko be moy tayaw ke dang de aping ku boku ko ran boku ko ko we ya be ko kon le ki ran moy ko jwal ran moy ko jwal che ni ay la ni ya le kre chiro lo ku ko ju ja to manatu ke ka kuma ete tong tu nga de ke ko ne nyin ta ku yen ke ko bogo ko je pinum ana walle bu ko cha e go ya cha ka yut go man the administration of the syringe e danja ya ayeni ran won to ke in pinge in akuma ka pienge ke in ran to no ke chan bu ke chol protection of the citizens ke pa ne chol South Sudan ache bu ke ti te dang bo nyal ko ache bu ke ti te dang bo chir ko ananga dang to yilo ma guti yinda du yigo yiran muktuor ku ci ye ni ja kem dune a kem dune ne luina la ju ya kem bo jur ko pe ku ci ye ni da du ke yen yinto wene tordu manatu you need to be informed ci mana de yen kan ko che ruon ka ai ke ya ke chol biological weapon a chin da biological weapon do ke piang Iraq e yen wal a yen ke to na we e ba wel ke ba ke ping kuna lo indol ku lo tang diktor che mane Dr William ku lo na ngen ke yen jwer ki na ye no mena kin ke lor ku jwer ku le yen agaranom na li wa yin nom tin manene chol dizziness ku liu ke chol korpio or korbangok manene ya norcia ku liu tin ga du tew thin because you are in agrat na lele ke agarnom aloke ado bu gonyin be okay in be treated ke hade ke lu treated lekin ale yi a hotero yi ku yi chinyen ku into deke then you are moving now to another diagnosis gir keto lekin ali ko do bin yal en ke ko be lekin ko ago yin ko niran ping we ko da we terwan ku that do this please lo e kene chier tan ko we are now into 43 minutes ku Dr Deng ade ke bejam please lo e ke chier tan ko wen ping man tine we ko nya jagong chuk it could be wrong time network rajeti lekin a lo ye chier ka be friends ko bila ting ku in ko kon so what we are doing here is a public education so in dictor ke to kurana kuma we ko ping tena kuma tene to intin pan tie chi kir ma yare chi belo ye tok na ye wo chi mana de yena gut ko ra de le je bi kir be belo ka chira lo antiel be ko jam ko le ko wai ra de kuna lo ko le ko pio na lo ran pio ji le dun to intin ku le ra bo wal der ke in chi kir ma yare ja ko nyu kunyu bai mana tu ka pa na ja ko in chi we ya ja ga gel kuna jala la lwel ku le yen an kor wal che man ko lwar de nga ku yeto te na cha ba lwerin in William one of the people that we know were ding just it was it 2 years ago e beneten to in thin a jal ku jam ka lwel che nang ran tung ran ko dir a lwel chi diktor che la yo ke ba gura a un ga jal ti je pia che kamera che diktor tawi na go lwel ka liu golwela ke nyiche gura dude gastric ulcer du golwela ke chelwel yene jowal yen na joli le walde go wal go a joli le Kenya kulokuler through every test achen benjila yo go ke achen gura chela yo you went through all the tests na won ke jala bi yo go jolo chi ko ware ga lele yen chok kwerandit a very educated guy but he has relied on the knowledge of the doctor but he ended up being a victim kuna nga jola ran ku ku walde kwen ko ana chi yen wala le ka ku be gore TDS ku be la BD ku la bungo a chi nyech ran be jalo lode so Lord go ahead.
Thank you. Kitwing kere wal chalwel example of diaspora. In a walk, wal high poison. Chairman recent example chalwel. Diaspora one of the life-saving drugs. If I suppose I have the clinics or in the practice chaloy one of the saving drugs I got out in a special cabinet. Chan while kene kucha addicted nong ran very difficult because anong anong effect yellow in the body. Nong konyit science. If we talk about diaphragm, it can take the whole day how it acts and how Iran benedicta addicted addiction nongin. These same drugs use non-coach alcoholic, not only run on convulsion, chimanon luin piniu kujina jaku kakuma. Ke nye diaphragm na chimet non ran non convulsion or what katel. These drugs anong a lot of importance. Yekaloi no work in southern parts of Africa. These one who are now actually are addicted to alcohol, you can neutralize using dice form. Ran alba ban ke normal because I really junubin ke de miao but I chudek nang kod de ke ni pintar chient na na you can run kalul today the world is turning upside down. I don't know in Australia there, but warga no South Sudan I will ga kene too much, but non ko de ken. So
War
you could use some
war
time for that.
ine kin ku tiek. Kere
Okay.
ke kere tiek. So kere tiek. Lo ka de ko jamielo ti ya gwen bi chawor.
Oh,
So
okay.
ke ke ra cham pet.
Okay.
Eh.
So yeah, well not again Junubin kai mi out there Kenyan Uganda. But now in southern parts of Africa, I chabla yoga something serious. No ko chelum ke serious na. Weekend a gol yum kamis. Una yugran ka you create ke miau ke town them. Ulwele ye ke polin kwa baga thola la eto. A terrible. And the important part chabi yo miau ke na ka can produce a check imported. Topic gina le benang tai bo jam.
Over
This is one of the drugs.
Benton. Well, Benton today. Go ahead.
Yes, okay. This is one of the drugs important. So ato in your clinics, kakorba control. And then in children, you could use into the rectum. If you child to convulsion. I can think a law in most of clinics. I hear warm either rarage. For it to act quickly, you have to calculate the dose to tau into the rectum. They are more quickly responded. So one of the important drugs, actually use sambala. And then the other one, pethidine. I know one of the clinical and medical director some time back, I think 3 years ago, Eli Ujuba, but chabe ebi ben no ran chana request ebi ben. They are tabana this DR. That is my area. This DR. Ka choka in pain for long. Putting the little quite these because of pain, especially these young girls. Pethidine. Pethidine chabu order to Nairobi ebi ben. Nabi kuloti on labor kagam ketiga this normally e be actual welding match you see can you painting beg welding match it is not my drugs e wallet on there kwa chabu control because e chat can baggage a chana cha pol beto sambala on the counter but let me in being a license muk because na loko you use well can kule ya addicted as well karana le boy no tichine yiran che ni a chiriam de ni a chin kile below in life well kai ga chol life saving drug kai ga chol dangerous drugs a chan well ka chige pol a chan be be into the wrong hands a chima purba ka in the either a clinic or a pharmacy clinic kuira nongin a dangerous drug. I'm happy it's not in Juba so much. People are using tramadol now, especially called surgical practice, aliu, walkene. So now on Chidi Arbiadis in that clinic, a beer cholen, Pachia Waldia, in Walcha invented. A chan pain in nyai. By use command and non cancers, non pains in cancers. One of the important drugs. Morphine. I'm happy is not there. I also use for pains, but they're dangerous drugs. While ban cushion, including the government, a tramadol. Tramadol is all over. Achiem approved beto, a jag achiem approved beto in pharmacies, sambala. Because while someone made a research on it, achi, if you know Boko Haram in Nigeria, these drugs they were using it terrible because then actually addicted in Boko in a wild in a different animal. They're not even human being. Kaya tinga ka now. So it can be jam scientifically a lot, but actually in the wrong hand, coach kuchin, be a right samala.
Yeah, na
But a
Chinese
lot man all over. Agache.
story lawyer
So
can
can me
Rumbek.
think maybe.
In deng in ba ngade a Chinese story
Pardon?
when I was in Rumbek Pingan.
Yeah.
Pingan.
In Piangai.
A Chinese story lo when I was in Rumbek kere wal kwa chi meya Rumbek che bele kan kulwele yeni na jak wal gak wal chol trauma do le gak in the market ku ka elo into the wrong hands. Elo majority emithi winto charity and access to the medicine. Ku man chene ke access to the medicine ke ka it turn out that they are overusing it. Ku yen ka riyong mit. Apparently there is an excessive supply of it. A in time where bajalti kulala who is supposed to be monitoring the flow because na later be law abla dira at outskirt of the urban Juba. Then where is the supply? O wachi jabe lula ka che ni keneto. There are a lot of other medicines when talk ke ben. And ayene kelwele, you are not the first person to say it. But right now, even one of the government officials, Chijama ke Rumbek ke Korkubu control now, and so they were able to control it in Rumbek. Akachi pulled down from the pharmacies. But alwela kadia ikena koko kweni yen legally. Kujola other medicines when talk chika mention in Deng. And at that level, this is where I came to realize okay, what is needed now in South Sudan is not about criticizing the government or saying what is the best way beko konya de. Na ngiyo kuma capability ben ko jam. Then take example na chalo in the if you change man tong jam walk if you can change a Dinka community speaking group. Come on, not in South Sudan a change. Maybe there are doctors who kabelo in the they will go and change others. So kere wala che yini took just to give you the and the same thing acha ping boria. Acha ping boria chimana deyen and the same in Juba. Whereby now whoever have access kuchakba lobo arechero kuba cham. Then and this is where now na lokere ko ben ku loko jam yikru yingo. Then kiyen ko la jame kijemo ko jemen chilo chare chika lelwel. But yung lui men chilo chare push. Achole ye miau. Yung driving men chilo chare yung me chani na kul. Lekina aru bi ale tare no ko ko jarot ko berucha. Yung ye chabag yiri te twenye ding. Eke ye chongenye ye kengo. Either chinang eyes, either chinang other prescribed medicine when chike lo apply kumo muke. Ayen biake, it is very important be medical practitioners who from doctors, nurses, pharmacists, and public health officials. Benang to un bene ke kiluran well. At least be well be because it's a buy ben na ran ti gare ten man ti no kulo an ping blockade ku kana nanga coin. So go ahead.
Thank you. Kichogole na jag dunu ber Paul. Panda no ngi kajuj. Ke na chalule yi. Ache president le pal bai bloy non kachi kamar we mane ay ga jalu la kar ha ko ka na kayila kwelwe kana. Chiman in loy to do. You know bin aku ngai ka lew. So kudun loy to do lew in thin in coin bai. Yo chen ga yuk thin then you have to work on it chan ba bai ba coin. one of the uh, honorables, one of the big person, achabiyok lagen dal kaman, ache yi leteler baitin kaman, ekichena jani pal kai sensitive, bikega loy.
Mhm.
Na yina power, because adam ke kuyen this sensitive part yen ke citizen. Example ni ke loy ke drugs, achan drugs, achiran pioj pande ni ke bay ko jab real South Sudan babili bungade dingi, clinic dingi. Mano that person is a medical personnel. Actually be that country Paul Benton. No. Ano ka kan nyu odra na che qualify. Awu ka kor. Ku na chalwel life saving drugs akor buka control. Ke well na chakalwel one of the drug also a life saving but also acha ting a use sambala diclofenac. These drugs are not very bad side effect. Maybe ko jël ñin man ko ne twany ci man twany le ke twany ko ju man to ko ro
Kucha.
kidney problem especially ko dir ko
Mhm.
ko to jong chen. If maybe I do the research today, I cannot miss 1 or 2, 3% of ko jël ñin man. Diclofenac is widely used. Even people want to advance like gam to take out the fever.
Uh-huh.
These drugs, if Iran chukun wal, kalaba understand, erwa ekriok, chale one of the guy, ebe atong di duraka na wagole duka yen meat, duka yen dia dir chdiop, puro dir. Ye waka jalo ke duan cha jal ni, chani na chi wal gam anti pain, wal ratupa, all this akoi bono. Duka gam because you are killing people kidneys. Well, can I use but now in all these clinics around? One of the drug that is also called big caution, non koi in use. Be wal be ngade. Ekre wal kana. So kire antibiotic a chiwa jam ne chan be jam red because ki kor binyi we ko lui at yem ko mostly ko gemwal. We ko gemwal now in drug shops. Kicho resistant, kuchi drugs chi resist like in South Sudan. If you do clinical research on antibiotics, almost all of the antibiotics actually lui. Why? Eye loitering. I think early in 2000, actually avoided by WHO can be streptomycin injection be avoid because one of the drugs in a tuberculosis guideline.
Mhm.
Waluma na they can use. But tuberculosis at all because tuberculosis is one of the dangerous bacterial disease. Na achi ben lui resistant kachin other alternative. Kana chat de kitiang man. There are people who are selling it because they way chiranang maybe young ratuba chinang brucellosis kran yen. Yes, but a little bit ni channel buwam. A little bit ni channel prescribe. Actually bu ach sambala. Well ka non kaloy ka in our life today. So a jam ba kuma ya be sensitized.
Yeah, yeah.
Kachir man iwal ako chia kuma.
Wi- William, thank you so much. Yeah, into something very important that like where I am aware you anti-malarial kather on you call the first line drugs ke malaria on chimani quinine kujala chloroquine phosphate kujala da chimane jola da medicine first line there were in chi western world chi ka outdated ke anti-malarial the ke lui used. And where is the production line? Ye kabo India, then verification or check verification when I jalo to determine the effectiveness. A good buy pana kawaja to the it goes through a very thorough investigation and testing before it is released to the public use. Now, Jalo Walter on Najalka the Ajake Luika use now and nobody is checking them. Now, very low here, a good use of the drip. It is very simple. Here, you know, Kokwa Winter Raka misinformed when it comes to a drip. Uh, when it comes to, okay, Tierke, watch Nangade. Well, I think Victoria Louis cut off. He will come back. Let's wait. Okay, Victoria Ben Malish.
It's okay.
Yen na lor ting ketero na nang golum ko ko wen jam wo jam bor tong bor. Ay lwelo na kanang tegro. Tegro tegro guluko the concept when chene goloko chene lwelo ara na chi goloko ke jala taban. Now on go boku jalku when I went into the practice we launched a community education program. Kukichu launch on community education program to educate people about the differences of the solution ilo go with. Yung ye chol glucose, yung ye chol normal saline, yung ye chol sodium lactate, and ku yung ye chol any other infusion. Ku yung ye ne yetao you go. Why is it necessary tenangi? Ekin kina ku an ordinary South Sudanese citizen. That yamana de yen if you are being given a sodium lactate. Anang suspicion of you either being dehydrated kuna kuna nong solution when deal it how you nanong welto that cannot be administered orally tenangi, then it has to be diluted into this to help you kukache ladhi meche determining the severity of twandu ache chajala ko to winji to eba go na piu chana go plasma do go boost up that's what we were trying to tell people. Then I think any man a good die social media kara na dom golo konde. Kache sur kana golo konde ko internet. Manatu we the idea is that yene ran e create bana ke chol glucose na jale lo ko ran ko lo okay. Glucose man e chol dextrose. Ki yene yeta you go inche chama chi be le inche tede chachok or your body is getting weaker. Ku chama chi do lo ito manatu ka yene kana go nang rieto ni go achecha inchi to can now medical practitioners are using that weaknesses to any citizen that can a citizen can date and that become now a bargaining. It becoming a bargaining manatu nalom wal whatever chatao golokoti kutao ka patient ya abeku tao ya kujol chol that is a lot of money because yen glucose used, but the patient don't know why is that being administered. You go, but a lot thing that coin coco that you are the doctor. I was just I was practicing. Go on,
Anyway, Jack, quite quite ngori to and remember actually came the gal 1993. Rane editorano to yangu jala duty de Simon Akwe. Londi ane ichio youth. Chan ko ju jagur chi jorolat. Jorol ga yu jorol ban bu
sterilization.
Ko ga yu ko ga yu woman. Akonong to talk. Chara nong septic wounds in ga yen a So kana dia chimana guchika ko thio war jel ka these 2000 gujiko around 1995 90s. Eto ko ni madgen na chi jal ka because kito ina ja ko na chira na ngin tinde ka lwel yen betaw. Da ka mana ayeke kadang ay ter ke da ka thio lo practice ka ayeke ter. Because na chira bang lo lana bu piu ko ka bira ne da alwel ka piu dictor chingu ba lo just imagine ay clinic kana. You can also you have to do negligence because if tichin kwen ko loy kichi luel ke ko ke biran den wala yen ran babe alaju inga yuko chol medical negligence ka chaloy badal bani pin wona ke ba explain that ke na chi yinia e wara ko bor. So one example is anong ran to operate on So that person, ranabla ringane glucose D5, little be in.
Which is that?
Goril no. Ko be miracle person now. Alwal no. Ngadi ga be yen. Ringas nong ja wai. Be
Mm.
ajam di dura ke work. Well no. Na cha jwere no mane. Ka chilo inum. Ko to tuka chilo kana glucose. Ranchi yende tuki mane. A chilo kana glucose. Ko le ya ga chi lui min 1975. So chira anda bu da ri pin ko le ngu chini to. Ye 1975 go in lui. Be atong bu ka dut. An chero ma tong ba dut. Chan kiran we to. So akin bulo kanim ka dia. What if be aran chin ngadi chin practice chir kana. So
Eh,
kito koy ko nim na chi yen glucose ka benang more effect be effective than wal. Kana che yi koy ko. Ku an ne wo ga chol ba lo ke tekro na tekro ai da ba pi ro la bala magabar. Ai piu ti ga yeni sukar. Wal ti ga yeni ya wai. Cái cái thao chanien ran won che ran le banyin ku ya ran cha ta ban ku yene yu ya
Dic-
electrolytes are chemical to you go
Dictor Wap,
electrolytes a ja le ran e
intuiting a screen.
boku ngu
Uh,
okay
intuiting a screen. And let's just, let me then ping again by young and Paul music. Why? Then check that and you can switch it off and then come back. Wait, okay. Wait, I get thing a camera, you know. Hey, and up here, we call die wobble do chin. Just be with us. Dictor of do chin. So, okay. Yeah, Dictor, welcome back. Now that
okay
you know, chow, we
so
know.
good
Uh,
na yu ran ran glucose example ran won abokan is severe malaria because severe malaria you could divide in three non severe malaria severe complicated malaria kujala severe and complicated. Uncomplicated malaria kujala simple malaria. So ke ko nong severe complicated malaria achin kite rane to rane chi confirm anong hyperuricemia anong a lot of parasite in the blood in the malaria cause rana yugula ko glucose ku bu wal bi jal taw ken wal taw ken glucose rana chan be electrolyte won be replace ku bi wal ya ci man quinine ay taw ken ngi sugar ay ku loy ran en ke chog ran da bu ken vomiting ku ya dehydrated a chan ken bi replace kay taw ci man ya chin ga loyel a ci ran bo ki chat ci man dien chat an ku la glucose da chan ba go la pin no ala bala de to ken chan ada kuin ci ngu ala bala de in la bala de gasir in bala de chai in bala de gucci madita ala bade ai fluid a ton ka de ala bade so achi necessary chani na chi wum ke yin bu go jala pin a piu chirke piu le bagala de kena le betaya a chani en ke piu ai to ke kak emergency we ko gemwal so na non clinic ke ga to ke kak emergency achi ga ran bas a chani yin in le bay economic apply to ne ya tin medical person gucci medical anong health economics ato a pure medical school in community health. Uh, so if you have to see your drugs, life-saving drugs, I got to pay. Few I got to pay because I got to for emergencies. So na ran boke jam ke ngui na acho ba ya mendu ke ngui na pew for what purpose? Watching indication because ran chi pure a deal enang indication nanong indication in kin gam kena boke emergency so in kin ka be dai coin. So ka ka halu ngadi ko ka apply. Then tien pana kem di health education important because kok be enlighten achi about disease only how to use the drugs binyi wala yin man chi jam na ne well when safer oral drugs I save ke welga so few achin ku kun ki yin ti Iran won to kin bokin rer kuin chat kuin bu ba rer kwa chin ngo kwa chin ki chin ade so chin ke ni yen piu so ken e wesi aka chir ka chwer go wali so chin ke ni yen ka ai ka loy ke ko won ko wo ke bo ke chu ka ko ta banin kala bi yen ka chi man mi bo ke nong daria aya dehydrated chi man ko bo ke nong vomiting anang dia again this same fluids in hospital I check use for people who are elderly Jack, one example, I always talk giving example. One example, no coach mo did red bay. I estimated around 80 plus years. So kede in being alwe nangar ana alwe lechi lo yon kimet. Ku kede ne e no ko kwa che jal. So ki nyai a piu a chu mu gol ko ka jal. So na chok gwere num ka ko lo num. So a chi lo num. Ay lwel ke lwel ka che yi duan ki e nyai ke dien din dien en a cha umu gol ko ka jal so ku jubulo e ke chol placebo so what you ngadi dia gol ko ke che kamel chu bata a chan bien convinced a chan psychologically someone can be sick psychologically ayana ka ter 8 years ago ke met e chilun kwanong timi che thor ko kwa chin walda pe na jagrana walda pe ka baga chinong en ku lura ten so a piu nyin kana chu ya based on psychological so nothing can lo with the purpose so I think ka chir ka lo so ran ban al bani na again pew ye designed by science I can design with a purpose I can lo ke ko winter emergencies go ahead
yen dictorin chale ke ane le we ko ping anang will anda e comment kon abaga ti chala ko a ko won ci jam biaga well lo won talk about ti abaga ti chala so I think abaga just but some of them are chuka bear ko ju jin dictor are appreciating what we are doing and I hope our community we tam ga ba de ke lu gi chier we ko ping wo to ko a reactive community why reactive community kien wo ka reactive community is that e ke chro ja loy ku ai nan one day de chan you know we to work new ku chin ding work you know there were no enough medicine so what we did ke chu loy on it and ke one thing ke belum ku te ke major thing it out into our minds Kichu tauke a very big weapon to be used a community education. And I'm telling you, if you look at Kudai new kuja chin a very big cemetery. It's one thing that people don't know. The death in new kuja very low. One tungka ke mastered working on combination of the community outreach program. Ku community outreach program and kidite to thin highlighting when do you need a medicine ke inera medicine in the first line unless in term of emergencies one of the things is that tonga twinku kan menya ko nim it is up to the doctor to determine the level of dehydration you go ku yen ka be wal kan ke mane glucose ni abijata yen ka be bejta we go we were also having crisis chairman walk enough supply can I chin enough supply then we have to keep the what we have for the cholera outbreak and we have a case like that okay wabokony at that stage now local community education program local tinge kelui go kubela into therapeutic we are doing the curative aspect of the primary health care center was here. But we tend to go into more community outreach, ko loku into the therapeutic, biaka myth. Biaka myth on ke majority ka won chaman yi malnutrition, cases of outbreak of gastroenteritis, cases of dysentery, cases of other that which were very common at that time. We now turn into into kujalada illnesses when they get vaccinated. So we went into preventative measures. Take example, there was an opposite concept. Ajuake ko ana lo indol ku bemecha tugo bekocha tuj kama bere lo konyor. Then already how do we educate the person now? Bele ken kulule yene man yelo konyor ajuake go wadunde. And let boka yena wera let match. And ajala let di jala mate jala urke man acha no. Manatu, this is where we go back now to tip sponging. If you cannot use medicine at that particular time, where will tip sponging work before you can use the medicine, or if you don't have the medicine? The moment we start to give education, whether in radio to Junubka radio or no, well articulated, very specific information during COVID-19. Come on, now to yen, the more you prepare a citizen, benang at least a basic knowledge. Like now, Angelo into journalism. I think some people will be questioning, can Ajak take in? I have been out of the area for years. So, to moderate dictator, so I'm not in the field. So Kalorat, I think cameras is misbehaving in Juba. Kubeka Konyira and Ping, the reason why we have this show today is to give you a clear knowledge. And where does that start? It begins with your family. Rantobai, Panamonjang, Kuyogo Kululu Wala Chilu used. Na non knowledge on all the antibiotic resistance. Kulor ku yokera ne kanang ke chol the culturing machine. Aliu pani Junuba Sudan or aliu in the village. Kera na chakony. So our today topic is more of an awareness. Kubi wajala thinum now I beverages. Kapa ekwan yuko kede. Kukena bi dictor ben jamtin. Yung react na walk. Beverages Angelo Indola and Mango Juice and Coeteria to Yen Bentin. Kilo Guan Gadia Yowata and Akato Sure, 211 and Akajianic. Waria, when I was there, a lot of drinks. Chemane nang drink chala you are Coeti and a Kaloithin. Kukajela Miaratok, ni deng it and a Coe Cholmo de war. Denkonya, a Cholmo Waria de.
Coca-Cola.
They are que. No,
Pepsi.
Take a chirin as you drink. Take all good thing. Akwe de japing. Achala yoke de in the Davatoma Kinde. Naya Luella produce Juba. Go
Steam.
Acha steam, Ekden, I in a drink my cold in. And I'm coker.
Okay.
And I'm coker. Luego look I produce Uganda, Kukaya produce Juba. Kukena ye the Loiten. Gwalola kabu tomjal de dekenyij den on because I don't know, but me aratok. So I cannot blame people. So I just Angela la part of it. And and ke dia de. Anang tung ye de ako de ko anang de ya de. So kedala mi aratok, but the question is, lo you know, what are the research behind it? And is it approved by the Ministry of Health? By the standard in South Sudan to be used. Lord, yung loy beverages tinang koch pani Junuba Sudan.
Thank you, Ajak. Before can I look in age, ana wal tung chan marwen bale ko to pharmacist kuna ne le radwen ko to ta in the power well actually barrage like these drugs are dangerous drugs na wal chole paramides capsule del ni wal kana cha tinga yen mit that drugs complication ke a condition called interception ci pet kan ci mi ti kor so na ci met go nang isal ci nang daria ka a ci ni ko koy kwa la bay capsule to ma yer e chol la paramide loy drugs kan kre persistent daria ci kre ko por adults ci kre mi so ira nong pharmacy kor ba you have to regulate the drugs don't give it now because ke loy man tin alu be bela bay laman ba amali la cause amali ci ma problem kana na pagin silent so bajalo kicha tiji hina jak uh, uh, Minister of Health that you go blame at it because what goal what so na lo ikdorat lo compare kan kallo ritman geography it to in thin we are far away from where they are and where we are going but we cannot deny the fact that we need sensitization because sensitized to be very much aware. Because if we say we will wait, in Melbourne, I couldn't go since 1930 beyond what goal early in 2011. Where can we fit in the world? Where can we fit to say we have these like example? One of the things Chiralo recently that one of us Gordon Matot, well qualified from UK. Actually, one of the content of the maize flour, actually good with the consumption. I was very bitter. I was in Kampala at that time. I was bitter. I will be jam group of fellows in Uganda that what capacity do they have? By the way, one on capacity. Because sensitize one on capacity better than whoever claim who is South Sudanese. Because in East Africa, one on quite pure, even US, one on professors. So Chiran be nom lwel wagu because we just came out today. So to come back to what you asked, important. We're watching production. So whoever producing kide in Chita, aye bay South Sudan. Kibi ko kan yike. Beverages are cold drinks like Coca-Cola. Our weather is too hot. Maybe that is what killing our kidneys. Nkana rokwa. Achana chipinchi toy. In a jab, bana piari go. And the most sensitive parts, vital organs, in Iran, protects, you protect your vital organs. The most sensitive parts in your body, a kidney. How do you protect your kidney? Chan kidneys, a major role. They control your blood pressure. They control the chemical in the body because whatever you take, balum ke pew or lum ke cham, abrula diem in the kidney. They regulate your blood. So even your chemical in the body. Kuna cha or
William Titin ke to kamera
call
nyen. Think de ti denga in ke kamera ya ga
okay.
la ka chien ku ba bela du.
Okay.
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 Yer ko
So
da na wer ba bere ten in manya nyede. Anang ko ba go and read the format of the interview. We are not doing it the way you think. The show that is happening here is called Conversational Show. It is an educational format. So it's not what you think. Journalistic interviews are the one that you ask one and get the answer. That's not what we are doing today. So it is very important to pay attention to how the interview is being conducted. This is an educational show whereby two of us, and that's why it is important sometimes to understand the description. Two of us are going one on one. So we are doing a conversation. That is the title of it. So open in and closed questions are not necessary. Thank you for if that correction fix the text.
Okay.
The in my guy, yeah, thank you so much. Chan talk by Chan Ben do tongalang Malish. So what do tong So William Lord,
Ayen, Jack Katwing Baroku Bagagelid. And maybe quite cha aware. Here go ro ran ben India. Nga chiroria. A critical rogel. Lucky day because sometimes they are saying you are what you eat. Na toy a cham. Long beverages. Very critical because work where South Sudanese, why just a consuming society. Maybe because what you are aware of ourselves, which I'm quite sure you are aware. Example, ran a little bit call no. Na cha call no, we just chat, we log in you dukan tok. Ajan you dukan tok in the state.
Binde kapiu.
Bapiu bagalum, binde kapiu.
Victoria ya
Okay, chimana ka war, chimana ka war chabeloy. Alwele bag in.
ya
Can in sugar ta da yato go ya week kake bati ta ne ba kan da gaida coca cola or ba da energy tikin da energy maybe a call a cha de ini jal go lo penya cha go lo penya inchi be ita ga yipu ba ga de kene dangerous to yourself babana le long piu ya ba ga de piu indil ba ga de tikin either you are from exercise or you were walking or you were from whatever you were doing. Not the Coca-Cola or Sprite or Pepsi or energy. Ke kaga kain ke loy anong sugar, anong calcium, anong phosphate, and other stuff. I can look mix, I chemical look mix. Najal good day. Then winter kidneys go up pure, or your internal organ are pure. Ujal good day. Anong effect like loy. That will be on, it'll be on and on and on. And then later on, it can manifest into a condition. Kutek bajare lies are like ya late, ya too late. Now you're too late, your kidneys are eating up. Achin the berangade. Allo be la loy, yan koko kayenke, ran la yok in, roku anong ni major. I think a little bit koko a little bit pinga. Inong ro, in the base can, lay can, la rong do anong major to enum. And exactly that's how it formed. You have a kidney stone. Lower bala de pew, I can be pew be dilute, be jal, to koren, if it is 0 point something 5 millimeters, mil, or milligram of whatever stone killer you in your kidney. So my bude chopping a that advice, medical advice, barku again, but pew de kajal, a little jal. Kuna barku chinga ku you continue on, then later on, kuro damage. Natural damage, then you have the things to go to India. Kido cha maize in this like example, the content of sugar in Coca-Cola example, nongi 39 gram of sugar.
Bro, look, we koi dai wabla break camera ya over head bank. So we back a poll tem ke duon ku ba ja ben du na yak ready and block yung an jam. Ku ba la du chien. So ding ku ding. So we back a nyai and you will come back. Right?
Okay.
So ayerga. We chukale yo koi ping koi token we chukale koi token anitene repetition and I want to be very clear on this topic. Topic in a jam within a cool is more of an educational topic. Kuma any educational topic apia chine de benang very clear message when lobby ku kebe lobby akor benang to in bina deal wa ka ku in Iran e chimana de yen kepiat e bar ni to biro kwantin kuna charo konge in Iran ke in pira piat ku ke pidu anan ke bu kwanyin ku jala ko won to pidu. The issue why we have Dr. Deng Chiengkou the basic items there or the basic information that are taken for granted. When you go kalom go ka chu ko korbu ke de mana de yen ngulu bi ko nye ke ye kaka. Kaka ban ka jam wo ke ni e kole. Ku ke one of the series that we will be running. And in the area ne jam wo one ding kokwa I used to format acha lwelu ar jamen one makede kwer. I am more leaning now which I discover within our community. Our community are used to the concept to cause reaction. Can benelu react to, but education nanora ane chida ekolon lo SBS during COVID-19. The whole 2 years it was about education, civic education. We have been doing civic education, but mostly a health topic from the psychological aspect of the situation. Kilo radikalon koichi isolated toke yide koichi patwanje fear of the theories when toke ben ye wali ye kan loyela kuna chabe ke yin bi ko nyade e kan gana chi kuma Australia chen lu ret ko ko looking also kanera anchilu ka kuma kwanchilu South Sudan. It was one of the areas during the SPLA chen wal juike to kutunga ka ke ko during the SPLA on talk by I ko ye ke chol the community health achen nurses achen the medical doctors are ke chin time ben ke lobby ku ai ko on che ke pio che ke chol the community health workers ke ka ke doing what they call the outreach program ye focusing on sanitation ye focusing on preventative measures. Could those preventative measures and ankaji chi ko ko ngoj ake ko which are developing a life of independence whereby you can be able to stay without getting any medicine that is being given to you either by the doctors unless in a severe situation in a ko jalbe ko so ke karbal wele tene manade yen in various topic panakim business economics and life, social life, mental health, and everything. Aguti life, aguti akukul. We are waiting for. Aguti akukul ke kwan ke wet ke lost boy. I've been walking jam thin ku walk over like an one William Deng wa ko poltaka. Anang ko win chi cook den war chi walk ko affected is part of the mental health. And we have to relate issues to us in order to change something. So nearly can wake as we wait. Nachi watch jam is supposed to be last 1 hour. Lakin watch ya 1 hour now and 30 minutes. So one be dictator about it. So one be dictator about it. Nachi ban ko wabe our conclusion kwa de bu. De ko wabe jam. Ne ka wena ko bi ko coach. So they will be coming back soon if they are ready. So what a live okay. Okay. The request has not come through. Okay. Leave it in the way. Ding. Okay. I'm waiting for them below the weekend, but can I get out? Okay, I think now then I can see you. I think we will be cutting the Jenike Verban the Jenike difficulty. Let me just wait for them because I cannot see it on the plus, if I go back to the introduction, watch a German, and what you are asking, if that is what concentrate any lotting and you are not paying attention to the value of what is being said here, there is nothing that need specialization that we have talked about. Is mostly the misuse of the medicine. So I can talk to even a nurse, not a generic information because how you talk to a doctor, what is the effect of the medicine, and being like to just go and look for what is that to do with the specialization. We are not operating anybody here, and we are not going to scientific aspect of. We are trying to give just the core educational information. So actually, Loiwin at the beginning, and we cannot keep asking it in the next one in the duration of 1 hour. What is the specialization? Is that necessary really? All right. Right. So we have actually I open the gates to everybody here. Ye dictator ya ka ye dictator nom ka ye dictator nyen ka ye dictator, and you have something to say, I'm here. Right? But general information does not need you to be this and that. Right? Destructive kada think. I hey we ka cha chera ka no baka weko. Kinarwa ke wengai okay. Then I will conclude and then we will come back for okay. Okay, there could be a glitch. And a glitch is not showing here. They just let me turn up Kubai Jalban. Okay, let me see. Okay. And then glitch when they are low. Hey, you know, we tang de never watch jam here. Watching 1 hour now and 42. We're quite a ping. The information here is very simple. Kilu el kuni and this is one thing that I even dunle ginjale agutian ko we will be going into okay, thank you, plausible, then I apologize. Yen ke kor bilwele ke maleja ke kor bilwele ke ke lora pani Junuba Sudan ko ache ke kor ban okay aben. Hello? Okay, I can see. Okay. Dictor, okay, Dictor, welcome back.
Thank you.
Dictor Kudal, Malech, computer doing liap.
Oh, yeah, no.
Welcome back. Kita walk is supposed to be our hour go kokla die. Ku kika balekin when you are free, at least we kunong any other medical practitioner in different specialization. Kani yinia. A good chaka cool that I don't have to host you. Chaka ding here. Then can host you there. Kuboko nyoike pin kuba some of the areas of concern. Beweke jam. That means you can highlight or even a specific topic when that can last for maybe 30 minutes without being asked about be delivered. You are a lecturer, you know that. So an be delivered in a lecturing mode, then it will be better than the conversational aspect of what we chemana bro. And I'll ben kulele katao ke lectures. And this is one thing that I need to take very serious in the next few times. Because the value of information and the more benokwa like and they are because practitioners went to paying we non ran ka pio ka belwela be deal encourage whether ye medical doctor to in America ka ye medical doctor to in Australia. Take example ya chimano ko winter Dr. William lab technician by it, and I think I know one person is a specialist. Kuke one of the people that I will actually need to come. Babiti a question to because then I'm question a question ke gura ala yori ameche ke gura yori ameche. I need to talk to a lab technician. Ke yeneri am to loom ku yeneri am to tang woga ten reagent to bottle already. Bottle chene yemiatin. Le ki rim cha ala lom ku lene ko widal test le lom lene ko Brussels lom tin ku lene ke the typhoid test le ke lom tin that automatically raise the question let nang lab technician ku le bara lab technician what reagents are you using ke yiri am to lom in 1 vial or in 5 cc ku jalate kam tin ne meeting wal kon ben miede de kede. What are the chances that the blood clot between kam ne kenin ke wona ngeri agent used? E ka ke ben na ka kor be ke tie ko won to ke nang this level of knowledge, especially ken chalwel non citizens. Ko jal be ko ko be ko ke na non ko woni ja ko ko le pinom ke penicillin ko kano ci be ben lwel na iran te kun ka ni che ko che ke no pe kwete ke on tem ke ke tin e kwan di te ci bu wipe out e ben tem ya wal ko ke ya te mo ko yi wal den war ci bin den war ci be ala chol wet ni chol syphilis yi gonorrhea yi wal ko ana wal ke tul ke nan wal ke wok ku kana wal ko le bi ko wok man e nan be ko le be ko wok wal ayeni rana kuma pinge kene ku yiran in medical officer pinge ke lwel ku wadeng mache palipio pinda ku lwel what is your patriotic responsibility, just palipio pinga bach ku lwel what is your patriotic responsibility na to bolis ka kwa chare ke muktuor agel pani Junuba Sudan ka muktor de kuna to ran SPLA bil pam ka muktuor ka gel bai ko yongo dangdu yin dangdu ke dangdu ebe citizen South Sudan ba protected aba protected wal aba protected bech ko aba protected ya ke chol psychological diseases che mane ye na chi lo indul kutewo yenom che mane ran ne jamana golokot ke be kon e chira lu wo ka kuma anan yi Somali ne yeben kulula alula ni megonjeka na yi mgonja yangu aye Kiswahili berfani anataka antibiotic ku anataka antibiotic na pelembo golokot ku ke ben ke chape ke dol diktor ababita panakem aye lwe sasa ukiweka pelembo na antibiotic nitapona kesho nitaenda nyumbani kama medical doctors ayi ke nyin jal bendol doctors aja bendol how watu wako what is wrong with them e ben ke bende chinyi alwel ko antibiotic ku golokot kuna yin ke yin ka bla ba na jelo ku jale tingra na ala ke denat at some point e be kene ke la tan ko kuman jelo tan ko enang effect aguti man miawe akin ko ke ken lwel che korbe study ke drug kiran korbe ni you are chala wuti by the way dengan ma chongolo yo ke ma wuti alo ka yere mi I have a photo denga ko yeto denga dai alo la ke da na yene ke wa jange wala la we chamwal e ma chongo ke ya chamwal ko wena rude so by a corpio jala twen wer dunia tinga ke be kre kole betol ku yonga tinga belum ku na no any other topic called please reach out to them. We are here to help the community. Thank you.
Apiat ya nang ke chu tem ko ne bu tol en ke de ba ba coin so that generations ke chi mi ya ku ni bai nga cha da to ra nang ni a chin ke lwel agoranda kine pin belum ku bra lo ko ye ema yem gane important kine julwel nanu kicha dira red ko ju cha aje nin because of benyiro ku benyi chan ko ka yuko cause opay ko ka are cause ka pay ko ka yuko cause with our lifestyle chimane sugar did it especially in cool drinks kalu ka drink mana did chimane cola no 39 grams if you go right anong 38 grams Pepsi 41 grams if you look at them kachika thousand those chemicals are dangerous to our body could mixture can mix companies, factories, we are not sure we produce to know. Kuna kira unong ginyi bibulwel, then we continue consuming them. Kwanong harm to our bodies. I'm happy that the government is trying to control meow, yala tobacco. So, and because if you are important tobacco. Example, one of the Europe countries, there was a discussion in one of the parliament in Europe. I was following last 2 years that through lung cancer. Through lung cancer. So ko ju bay lung cancer. Over 20,000 people are by lung cancer. Well, because of smoking. So with smoking be abolished. So now let's discuss okay bila we not let smoke actually stop because the ko ko le to ka ji be benefit can who can be a benefit to the government. Because people are now struggling with the economy. But for us, this stage, actually, allow so I'm happy with our government. They are trying to control that. Because when you consume more sugar in these beverages, whether energy, Pepsi, Coca-Cola, based on American recommendation, especially American Heart Association, they recommended sugar in your body, 25 gram per day. 25 gram per day. Kwa chopping the one beverage is a little 40, 41, 39 gram. So that is only for women. For men, 36 gram because men they worked a lot. They require a lot of energies than women. And then in Juba here, if you get such people, you take a lot of cola, you take a lot of drinks, then jump into your V8, they accumulate there in your body, and then they increase. They only increase your weight. Your weight increase. Now they increase. They manifest into other kidney damage, or it goes up to diabetes.
Ayandi de netwine.
Pardon?
Ayandi de netwine.
Yes, a bit. And we burn to it. A bit. A health person actually benang yach. If you are really a healthy person, actually by yach care because ki yach by kake. So you have to do exercise. Make exercise. Actually, while they watch, you can't talk. The best drugs to your heart, to your lungs, to your internal organs. Nachia manifest, but sugar low a lot. We can exercise. It can allow leading to diabetes type 2. Diabetes type 2, a bent a lifestyle because in the sugar that sugar accumulates. Whatever you take, quinine sugar thin, the body converts into sugar and is stored in the liver. Now, liver, then you keep add on quantity exercise, be sugar cheese store be used, leading to diabetes, and diabetes are not going to be now. Kena le bangade la ban ke jong sukar la domin na domin ko be difficult eto kana that row in chati ne yachi a big yes because yachi che miawo to ke bay when you are taking cold things because your external organ including your stomach actually clear red you abijalto ngadi ablier ku jalbana college ku nyuo ku de ke kicha loiten you interrupt your internal organs. Your stomach acha interrupted. All the chemicals that are helping your digestion acha kriyo tichin kriyo acha disturb na acha disturb kaka be chemical that helping your digestion whatever protection in the stomach abi stop working because abi changing the environment the internal environment na chi war kaka brolo itini they can form whatever process will go and form the gas yen ka kat man woto ngade wa anong gura actually man one of the big guy in the chalwele actually actually gura because they deng pu lir they deng bibirgis clear along your gas form, now lu gas form, that gas manifests like an ulcer.
Okay.
Akor ping apia kana like an ulcer. So in liba jala jar ke white or in liba ban in liba nang a lot of gas coming down your stomach, well, because the lifestyle do in the color. So internal organ ko achi be ngari your chemical that are protecting kedang achi be lu apia. And then a lot in the nearby clinics, get test bila lu yin Ajak medicine lui practice. Go on lui practice in 1997. I can't be practice now. A good chico lui practice today. Be me call practice ke traditional medicine of tomorrow. A be a traditional medicine because they keep changing. Kilo could this year a different because people are not sleeping. Work culture work anin kukoi rachanin. They are doing research and they are changing every time. So maybe in 1960, those ones ake halsa ike yorimi. But now anong machine I don't even see in the clinic. Anong machine I taught in Melbourne. I chok kotik. Na bila test in halsa kin yoku ba tok kwak tin ko ba kotik. It will just read a simple test. But ko yuko lo it ni na ji chok lum rimi kule lum kale en specific. A chan test a test bani logic any true. Ali bilaban ke read ke wrong a false positive or be a false negative. Ali be a negative nangin when it is also positive. Ali be a positive nangin when it is negative. Getting? But our fellows abogu jel loy na a positive in jel yen a lot of drugs in bijal in bijal chade ka ka dia alago yin ka other poison like art in your body. Because I can be like you. Ato today. So dung kalir the gas is like a form. Like recently, you wear kortum. Achin ngadi bi ala you. Also, I check la you in a jack. It be ala you are gases. And what form the gases in your stomach? Ake kachakalwelka. So people have to refrain. Dung kalir akola 2 years, but lum put outside the free. Because it law coin him, I check the killing in goal up yes, in the goal up, but your stomach accord between a warm. Achi could be air. Achana internal ato inside ku kanong anong chemical yen protects achi kurbelier in le bagolier but yan yo achi lebelier digestion will be as slow and kokok nong experience will be luel in ke condition to most of us now ikene akor be brand pingen be dilo apply ko ba you will improve
ajal pia wale ka lwele ke ajal tonge cha tonge ku bajajar ku kwa la red kungo ka ke bena ajala bene ke ka ke
exactly
outcomes. Oh,
so
okay. Very lesson also.
ran pingen so agutu ko ngwen be ping ku bela ping especially going when cha le gran klon because an chin ni na ja gan kun so I cha le gran klon now pin na malata pe the chin umur 60 years there ako bara praying from eating red meats ya ping mana ring ring because now people coach in ato now ja ko ja was going when ko it paid me a lot and ka chik ma prove ka chenak because of lack of sensitization ko ja yani ke ka mis available and actually non coach wo ko ja matong jeng bana good blood gora godanti wo che cham fruits ye yigna
yigan
wo che cham fruit guji woni wo mi da che cham akuj fruit ke chol dinga a chi ga nyich e cha kuring kurai so we are lacking a lot of things so it to what you man juba ka ja cham yinga ajul ko bi yu ke wal ku wel ke they can take you long ile banang run jwe so cham ring ki in chiara and it's dangerous it can cause now people are dying of cancer ano korbale
alwa yi koroblubia yi gwede yingo yi
yes yes kaka alba ka cham kaka dan ku jaka chiri ko kit ka to balong da liu dur chi mani ko jai ko taw alba ka cham achan barun ko ba ka chwar ajala ting ring a chi ber piat kan your intestine Now look into science, you understand, but or actually understand. The kin can book inform eating too much fats when you have reaching that age, 60 years above. So you limit your activities of what you are eating because your age are not compromising some other foods. Then you also enjoy fruits. There actually ben quite acham dangerous things. A little tick na achin date. Ako to Australia yak cham date red.
Yeah, they did by it.
Date ko na ka purify, but date ko achu ni ka produce no. A little tick na achin date kichu na chitwak. Then also nong kai ka tau mithi. Those food, those food, especially in such gathering, can kill us in high dangerous.
Go ya. E gudu na kage ye tuote ku ko ran bana tong no ben cham. And I always say, like, for example, and allergic to that. So anything with fat in it, eladim badil cham can at least spicy, be spicy to neutralize it. Ku ke chalwele one of the major things, because, and this is coming down a chan kan jam one ran a nutritionist ku ke South Sudanese young. Where chalwela chikan belwel yen a chibelwel ring den lanu na jalo indul ke maite na ring ajit kuring to kuring bew kuring wong kene tal ke cheya tal kene ke kabab ku tal kene ke ngo so yen in be jal ta na ba kurale ku lo ku jal yen salad jal cho kur kanara na ngewa na ka kuma ka chen wa war Nairobi ka chen wa ben na untina wala na babai go go ben 202 go go ben ka 203 go go ben ku gong ku sukuma we ber go el ku go le cha bianyo de wal yawo cha bianyo de wal na yawo so kilo rat nang ko chi it come down to na ber lo on ke chiman wo mi don to buy, you know, walking a different way of living. Walk a chama pul, wa chama langa, wa chama. Kumika wan ben kulor ku your cake. Now looking at the benefits, okay, token a cake. Kujala kujanyu pinya lokuting capabilities token a riat. Kum, a chola gear, a chill. Well cake. Kujal kwajajal kala bay kuto. Anang bala yo ke ton rot kuton kech. About chwe bela yo anang chwen rot ko anang chwen kulor ku yo ka gut chi me amoyo ku babela yo ya ka kulor ku tinge ka gut bubu gutu a gut bere la chamalang ye lang nima ka ye lang ror gut babela lo indolon tenan ko woni cham wume la ka nyi ko yo na lo wume chamala ke in babay to ku yin cham na lo la do ku cham ya ke in babay. These things were when we were growing up, walk over to buy, our bodies were getting totally very mixing different type of chemicals. Ku najal wala yoma ne chema na cheke jwara ka yana la dollar anang videos chana chama langwar. Denga dollar deng chat ke ye na lo ku yetingala. Kular ku tinga kito even war chala liawe lwele kene chech. Lwele barala yo ke chluo. Kera akala yo ke chluo. So I have this kind of a village mentality. Chan ba du chien ba pir ba ka ba kayo. So in dictor, it come down to education, and we will welcome you at any other medical practitioner. At least na long time. Please, from now onward, go and prepare a topic, and at least 30 minutes. Kini abar. Ukaja anang ki chiro wilman tang time span ko ye die. Alwel kawaja kulwel time span now ko the longest Lubera anto internet die now majority of people. The longest is 20 minutes. The longest in Kera and committed. But you will the longest actually 15 seconds. Ku kachin wer bera ping it. So okay kito chamana dena chala lo indul miak chamane specific to medicine chamana wala ne chakalwel. or chairman specific situation chairman type 2 diabetes manene jamo ko jabana man tin yan chinang sugar ya ku kene yela ku yenda du da gura ana wer che ti chitene yongo yo ko uh, yongo ko yene bebe ju jene ke ju chaman yi typhoid yongo malaria dir e ka ke bana will let you go back ku mia tangkin nang then you can prepare each of them a good man work man one a research by Ministry of Health go Australia about the use of chicha kujala babes ka ke bana nang a very good by the way you can put the 5-minute meeting chicha e ko korbele ko to junuba na will come with that topic a lot for the 5-minute meeting chicha 45 minutes equivalent to 100 sigara equivalent to 100 sigara. 45 minutes of chicha. This is a research, a medical research by Ministry of Health in New South Wales in work. And I will come back with that research. Documentary. And this is to inform our people to keep walk in the Western world. And then some of the things we know adil ko coin aba adil ko coin so yen lo twen ko bu jal tok.
Okay. Before that, European Kudun, but Abu Them, young and friends talk. Looking at the busy today can free.
Yep.
Your media.
Yeah.
Your media is actually helping across the country. So, Benang, you need to also introduce some episodes in English.
Okay.
Ben Arabic kuta alibangade alaba batao. Ache jenga to ke bugale ke junubban. We need to inform people that people have to take care of their own health because work you will prevention is better than cure. Now, if you enlighten, then they will know where to seek their health. Important. Chira le be gola jaka charan be pan loy. Achiran bulu nyal. Anam tike ko chirin ko kok. What all on buy. So ran be ko be informed because ko dir ko achi aware about themselves. Jala ko all our entire population achi aware about themselves. Ku ko ben man ke ko coming for help. Bi wo be coin. People are on different views. I live in different intention. So kina kor baloy can but so what baka introduce in your media can because baka enlighten. Because be deal ping be retreat. Chiman war be corona chana chika waja force awe ka waja ten ka lui force. Otherwise the check dan ni to ma tor kira tor war. Awar chibu kwanyi kok. So chibu be accreditor. Kuna lo ko our health like in corona like kichir war coronavirus ka chirana bay wala lai chiran bay because bay expensive. Kena bata penya. So work buka sensitize because be retreat guji ko ta worry big inform. Achan kena work in town eating habits. Ti work chiamtin achi self. Aguna chi ya daga kogini ake deng kalirun cha lwele in ke yachi in ke duang be kana to yachi yakin lo exercise achan it can form a lot of fat in your body. Achan brand ban bradil tit. So kene important. So you are free anytime. Kaju jalu buka jami. Ki cara prepare ne jong chwanyi ko be jam jak.
Abu tau ke topic. Achu ka
Be jam.
Adit awe ka ba kar ba yenin ke cool pay because jong chwe jonga chwen ku jola the causes ku jola understanding then within walk in understand ku jola the influences of other diseases chemane ko win ya one of the areas when one of the major specialization area do chemane HIV AIDS and as a contributing factor ku jola ko kaya chemane hips ye C wala A ku jola yene ka win kene kenu ka data. I think I need it to be bara prepared ku be presented ke yene tok ku ba buto in the show whether any time in free ke in bela ben because yene man most of the time ben ran ben in ke chaping in ka lo ku le ke jong chwenye ke che in ka che no jong chwenye even me that work arba date at a certain point at some point I'm very confused what it is because the level go lo ke hepatitis B ku kalwel ke na hepatitis C ku kalwel ke na ke che ke ne gol leke so I need you to chan man watch lo 1 hour and something 2 hours almost 2 hours and 12 minutes ke then such an important topic ku be taw chele e ka chi ko lo scroll so akor be chu taw ke kol de tok a gut che ene tok dadu a gut che this idea of antiviral medicine when chika bay a lot of people are not including me and a jamon one dictator chole ayomdor and in that regard ku akor benang a very clear knowledge because chala yo ware chiman kichi ko kwari yo man yen jong chen more than ku eta chir ki dol akoy lo rade we need to talk about that and the list goes so book it yen cool in free ku other I think on ane chakan jam one dictor bor and any other medical doctor or even Australia other doctors went in the field. There are a lot of things. Yaguchi the psychology of patient. Chairman patient ko. If they can trust, I will give you one simple example by it. And Mo in South Sudan is a dictator temrul by it. Mo in Sudan is a dictator temrul by it. Kuka temrul in a very very funny way. Alwe liyene dictator la tang dictator go lo ko yok go dictator lo yo kitchen hepatitis B. Na beri e jel kule tang dictator go dictator lo yo kenang ke to ken hepatitis B. Go lo kulo indoler ku teus tekende jepi kule du pane chol no park. Bi kule ke ba to anya yo ago jel ta ke ran bo po GP appointment. Ana ye ler kulo indol ke ler kule ke ba be cha mo nya go. Tem dictator ne Biden akato se jene yon. So ana lor ku yok de ride ben wo ben jam tini ya ke tongo ka twen ya mi ana na lo free or even ko to ba it ne one a problem of women being seen by medical doctors ku ke ka chin tok and kuman chin ke tok na ler ku lo indoli ni diar kon ga jeng na ler ku lo indol ku ler ku yo mo ko mo je diktor ku ke mo ni jam tong den. Take example, yen and very serious issues in our reproductive system. Kayen terminologies ke jenga very root. Terminologies ke jenga very root. And ale lo indol kulu ele situation de beguir in tongjeng. Then it will sound root nange. Except dia pal de ramtin jepie will be open up in ale be open up. Lekin ale lo indol alo ku ye beguir tongadinde. Ale be lo kulo indol kena kalwel ke anoke. So misdiagnosis. Abeto ten ku pain and ang pain. Take example, na go nang chankret. And this is a very common thing. Go nang chankret that's because maybe because of some STIs and everything. aka cook chan be jal dictor ke mo kulele yen my private area yen aku kanango ko kanango. No, she will not say it. Manatu tingi jenga nang chances be misdiagnosed. Australia today is happening. Na lere kulo indol ku ye moke moju ware to. Ko moje achin terminologies moje interpreter, yes, is a anyi tonga lengelit, but a ku terminologies ke tonga terminology, medical terminology the tonga jeng. Now there is a communication breakdown. There is a communication breakdown, so chances of misdiagnosis are. What if can alora chemana mane juba alwela non Chinese doctors. Chinese akui tonga lengelit. Akui tonga lengelit. Yen an interpreter te de Arabi juba nyi kutiga nyi Arabi juba. Yen kito ye akui tonga Arabi juba. Or yen jalgo lo indole ting bore ka lopa nakem. Kumo imbore yen gwar koi toke. Akui terminologies, medical terminologies ka well. Okay, what are the chances that jam mo China ku interpreter kutik will cause a major thing? Ka kebena kar bin ke wala any other medical practitioner. I have all the topics and I know how to direct them as educational topic. Ayan ke yin ku ran pingetene ben. Yeah, welcome to come back and let's discuss this. Na better into the field here. Manene ye jala tu ka area du. Kaka juic achan kan jam wane dictor chwora nakin chemane kaka gynecologist ku chemane ko diar won to ke chinang C section anang a conspiracy theory won ter chi jeng chi bio chimana de ting rete ache bandit. Is that true? No. Biotin is proven. Lekin what are the aftercare? What are the care needed? They are chairman war nang kichiro ta nyo da nan diar chike apole pen boko gole juny abu gore chor ke nya rol nyo de ke nya na nyo ti ke ke ru ka dirin la but it ne was it ne just a very C section yen ganang. So what is ye kiti ye koilo ye ke ko ja ending up in wrong medical centers ku ye chere ko ke ike obstetricians ko ke yig dictor ni ke to ye ko ideal rate ka be ka kon ku the more ben ka konya le ka manatu kara na badila lo indo na le lo tang dictor e ka be dictor ya be nye che dictor ben ni kriye ben dictor te ku dictor met ku dictor yi ku dictor nyin ku dictor rare yi awach ku ka ka ben the moment we give this to people, to our people, kete da bu ka konyin de nga ye nim de jal we duna kelwel and we call it a day.
Thank you. Yen in Ajak and get it. Ran to go by coin by York sometimes. Yen today na time can pir ko nya time kulo ran yo ko ko bre yo ran ko ko inform chan bu ko coin nano that obstetrics in my area kulo ro man ananga malia ji galo unnecessary actually indication chi ran chi nyuwa but ti jiban kan or him di ban e chin or be a chok during labor liberal will to conclude na de anything le amalia uh, which is not actually unless if we see a complete breach but there are law because work obstetrician doctor now actually quick but I don't think okay what general practitioners so can bu jam some time I can C section a last option because you have to save two lives. Either you lost one or you save one. Kena benang topping there. So kebal ko koi pengin e binyi ajaga chingadi achi health education achi baby. So by babe utaw ka ku chanen bin ko inong pikra in health before in the bush a good today. Achan ka lo ku ke tibu ko e jam. Come to what you asked before we conducted the interview. Actually, the kula chalio because the chabuting na alar balui. I was working in Jonglei. Alar balui, I was like, I'm going to be like a drop in the sea.
By the way,
Come when but to kuliep.
randu ke rantung du ke che gor ku bajal mariare chapin che Dr William Deng Mach, my boss in CMC and Great Lake Institute of Health and Health Sciences, Yerol campus. I'm happy to hear that he is the hosted to enlighten and educate the public on the risk of misdiagnosis across the region. Can't wait to be part of the watching community. Thank you. Go ahead.
Thank you, Marial. Marial is one of my students, but also a product of Juba University. Thank you. So, ka chiri gina jag because randa nyi ping, libu pir ki ping. This is the world of media. Ano ko loy chwali. Example, in early 2012, anong assessment ni loy with one of the white lady, a place called a youth. Wachi mo inwere chubula yo ke yani koy kwa ne kala zarka chula yo ke ngadi taka ye wome kidang ye wome penicillin tak na ji kala zar a chi buti ke juri be so taka ye rwanya na che yo ka ji windi da jo pyaltin ku te waltin ko ja la pyal so na lu ben ku yuku ko mach sap ngu dai nyan ka waja butok che kan ting jel bo ora yo to na ko butok che kan ting chabati ka ju chablu no ko ka pya le chira na tho because chablu ngo gole ran ne le ko ka ran chin ni but by the time le pye le ban tin bla ban in this area I chira ber them chin kol to ala pye le ban ka be aping kiman yamo ready u le ran them it will not take a minute
Anang
pa
deng
kher ka lo in science
deng anyi Dr. Bora daga lwe la chawum. Anchi nyonya cha dom. Era ancho nye pe anchi nyonya cha dom nyonye. 1984 an la du Juba. Jagula bana chabu umnum. Chabu umnum. So lekin ba a chabu umnum.
Russian doctors adil pyochi Crimea those on finished 1960 Crimea hallelujah
very bad. A chabu umnum ane chenanga very big infection. Go umnum. De loirati ya one by. These are very practical thing. Anang on ko on ya bile akoye chloroquine bile thinon. Yeni ya chloroquine. Ni che ye youth on kudek. E che ban wo.
Abarte man lagi.
Okay. Nah. Yes. Okay. Okay ya kaya ka ke lwel yen ko very bad thing ran on umanum e kraj below e kala ne mende. E mende womb go mende to.
Sorry.
So, and this is penicillin. So this is the result. So kaya ke discuss ache ka koji. Now because now war jalo on kujali intermuscular jalo queen. Kujali yatiang ani ko intermuscular. Ku an ke subcontinuous. Ku an ke intervenous. Ku alele chi nyale jako ko ke because yen our people were injecting a very sensitive areas full of nerves. And cha jalga ke ran ben tanang but ku ke ngol jalwel ku la tarwen nyale ko and yi this cross kimana de bangum betem ko anang yi etila liyo yen jalbalwel yen ke chole yen yete ko kayena ka bara to nyene ken so our people need basic education bigger coach I ke anti era loy te nye ye en chumnum yi ja en jal po da en ne le ga nye so yeah
ai dale je ko ken ran chin kinyi da ko ko but this pin nang medias ran ban ya aware so I chiga belo ka kana loke you cannot take a minute in lot of law to wali can I chabuting I will be just like a drop in the sea so I opened a school the purpose of opening that school in Ajak anong gada up to now I'm trying to push the ministry binankloy work we are producing surgeons number of them are usually red but watching anesthetists anesthesia core achan walde tao achan branin kujaran operate aliu so kini kar achan be pyo achan be ko be junubin be nang faculties of anesthesia aliu jama juba can be introduced achan be ko be kun achan a very important medicine I ignore but na chen ka anesthetists the surgery is successful kana cha bata kulo nun ke reason yani yan to kula ne but I was advised to produce other cadres because the kin ben ke ka register sin ke koka but I'm still in the idea that can drop still in place I can be coach coin kana no ran on skill be coach be junubin be coin can walk what look reach ben look closed we are losing everything we are losing money we are losing anything so like example, one of the person now, yeah, is specialized ENT surgery, and they are about 5 or 2 because they took a Louis. Man, Dr. Shual mana kony kajaret. We get charge no coach. A lot outside. Mana a lot Kenya, in $1 but coach coin man in local currency. Kachirka ka kor buka increase buka ko biban. Because coin. So in reason yani yan to kulip. And that school it was actually for anesthesia. So kuba coach in this episode be locked coach ping and be coach be kala aware. Especially makulet cham cake what they were born a time bu jam a lot of them bu jam. Kabuka deal take brand ben brokon anyay life hard but also in this hard time akor bu control. It can be a cheer goom chocolate bro goom lekin be expensive by chirot gum achan chok chala limin leba cham lekin be chin chili bala lim wal dangerous chira loy so gol piu ko day like all the towns akor be careful guji kayu ko cham so ina jagin chale ku coach walk attend shopping achak le kunel ya ko ken jinubin en ke wadi na kar in chale yaret
yen apet incha lejaret William ku thank you for your time we ko ke ping this is a free ran korbele jetena che wo ko ke media yen Dr Deng because ke korben ye lej we ko pan ka waja be baben with the skill regardless of how it is baben with the skill like what he has done now ku ye pan ka waja win ke ka kan yan bran ke to le tv nyen they are paid yen ke chang wo ke bu ya producing 2 hours video for educational purpose pan ka waja win che I will you away somebody need to pay us for our internet somebody need to pay us for everything power lu use money juba somebody need to pay us for that so don't underestimate nyake ba ten chan be a medical doctor ka journalist be a hosting a show ka kon ti what is in it for me e man bala ben man bala tv nyen yong bala yotin or even now but taking time out 2 hours what bala yotin ku kor ku bulo Iran ping achin kir ma yadi be ben pen ku jonyu chalo ku jo ben le ko che tiet ke ni nor benang 2 hours ek manatu ke yena lo 2 hours of health education e ka be ben lo indul ku lo 2 hours on roads o ben lo indul ku lo 2 hours on food ku ka kuna lo yen ya ben ga bai. That's why specialization matters na chinga ben ga nan kelew kide ne offer as a Jagong media team, and we thank Denga Kwe in Juba. We thank Dr. Dengea. This is our voluntary service to the people. Kukanya and value de. In Deng Bai tena kuma Australia tonga katwengi loy. I'm telling you, when you kuma Australia is spend chan bukoka inform. I millions and billions of dollars. Anang TV e chol ABC, anang radios ko anang TV channels ko all that ko anang SBS wa lo yantin SBS e chele to ke te dro ku bak ko anang TV channel le TV ke the tem ku an le ke yin ke lo TV ka ba la war lo yantin akuma ke wa paid. Now I'm just volunteering here. Akuma ke wa paid ku ke da responsibility da to make sure that benang credible information below to the citizen. Pay the Roben, Kalunga war, kana long jadit deal passed by the parliament. Manatu long jadit pass, one responsibility bulo indolku bu summarize. Kapay ni interokula pe longa babenbe kulong te venin affected tineke. Now in a journalist of that community in Bijalba and Mengujalo indolku okay and bako coin. That means you can expand on it. Chan bako kon baka inform. Achaka census kulelo koja kwenke kalwelo kulo koja kwenke. Tingu mana chin kiche ko pio cha chin kiche pio pa ni Junu Sudan. You take example war chire piat. Kunang man ti ni chire ka che aucho Juba. Kichwere tinagak. Ran to chino maben yen to gole ko ke yerul ku ko bor ku ko ke panjak bala gol malakana bala gortan. Ai pire piu de ke kir. Mana to piu ko chin purification meloirat. Ka waterborne diseases are going to be more ka che iman chena bor chen ben. Chala loy war I went nanti bela de piu that because an korbanang ancestral connection yin ba chan ba Juba ten anti ba yaro de ngeliu de ngejala de ngela bor ku lok ba 1 week and na ta video be ka lel ko yat in ga tem kan I was badly sick because jal baten kan chen kakamal wala na la lel manan ti ba kan ci koy wa koy bare cha cha ke yen legitimacy and when makedi tom gum an ci bari yang pana ke ma kwending in ka chabela ko ya ci bela yen anti malaria I was badly I was vomiting like no tomorrow so kilo radin dictor ku yiran japeng I can see my friend here David Malak yen we koy japeng walking law into detail, into scientific details, into things. Red meat can be expanded. And I can give you sources, but what we were giving here, a certain level of usage of red meat that is discouraged medically. I can do bear chama ben lekin, dictol and the HMD then, yani chaman ateme. Ku kalwela ka chama manu ku ka bere chama miati ku ka chama nin ka ban so ke kar ba le kini dictora le ke ka ditangin for your time ko bakale cha ko won chiping ko che chiere ya Ajak media will bring you a lot of things in days to come resources ka bungo de no an wog lekin na lo then loy then we will make sure a good year suggest to us topics kebe koy koñ kwa che only educational aguran cho ko cha dal rana ko kol pia aguru ko inde nge kor bu bela du ya ko kol kwon ko poletaka Kurnyung den mi don ne ku cham ku we need to talk about those things. So yini challenge mi jalo. Peter de Akwe, thank you so much. And thank you for humility always. We call winniping and I want to clarify this. We call die videos to Juba ku videos bopani Genova Sudan. You know there is a man here. In gato behind. Chol denga kwenukur kene the team to kene. These are the people responsible of those videos. And now non kupia dun korbelo ku beting apiat Juba. Please, we have a team. Ajak only the face of Ajak Deng has been the brain behind it, and you have to know. But the guy got a very silly mileage to say it. He don't like to be in front of the camera. So, so Dictorin Jale, thank you so much. Thank you, Peter. We're coping. Thank you so much, and we appreciate you for the time. Keto Kole dedicated to talk to you, and I appreciate time cha yen walk and be jam days to come, and I will specify it based on the medical research that is available, and those are going to be referenced in a very good way. Ko be konya bepping a chatting manelo mit question mit achem mit lui bepping rate. So it will be one of the things when I talk about jam thing. And I thank you. Na non ke chalwat ke yenin chule na kan chier ke lui chier. David Coleman, like, are you serious? Okay, now they go around ko nim ko dear and and jiran kan dear and I know. That will be a very big thing. So thank you so much for your time, and I appreciate you for listening. And thank you. Loike chair, jag media, jagong media, which you college, we quite good. Chukalor, and a jande. Yar kalena kwe kikiritana. Yar kalena kwe kikirit.
the tempana del one quite. Be than to the money ding dan, the Muna Jago, while later up in the tempana del one quite. You buy Jalan Jiban, the duality, and feel like you for my enemy. Now, while you need to come by your ear, why you lord, why you got more